the partial knee replacement is replacing only one part of the knee which is more affected by disease. The knee joint consists of several compartments. We have an inside compartment which is called a medial compartment. We have an outside compartment which is called lateral compartment. And we also have a patellofemoral compartment. Arthritis of the knee or any knee pathology and disability and pain mostly coming from either medial or lateral compartment. There is very rare patellofemoral disease also present, but what's the partial knee replacement if it's only one most affected compartment being replaced with the implants such as a plastic and metal components. What's the benefits of medial knee replacement? The benefits that you addressing only the part of the knee that caused the most of the symptoms. So if patient has a slightly bowed legs and most of the inside of knee is affected, not so much outside the knee, you want to preserve the outside of the knee and just replace the diseased part of the knee. With a partial knee replacement, most of the important ligaments of the knee have to be intact, such as ACL and PCL, the ligament that in the middle of the knee have to be intact. And with that type of the surgery, if the ligaments is intact, the patients after surgery feel more natural, or they feel like their own knee. They don't so much appreciate that they have a plastic and metal because they have ligaments, and each ligaments in the knee have appropriate receptions. And they can feel their knee in space and feel that their own knee. With a total knee replacement, most of this ligament have to be sacrificed. And once you sacrifice this knee, the patient feels like the knee is not their own knee. They kind of feel that there's a plastic and metal. They feel clicking. And also rehabilitation process for a partial knee replacement is much faster than for a total knee replacement. With a partial knee replacement, patient can pretty much go home next day after surgery. With a total knee replacement, usual stay in a hospital, it's up to 3 days. And sometimes some patients require even rehabilitation, inpatient rehabilitation after total knee replacement. It's much more involved procedure than a partial knee replacement. Now, who's a candidate for partial knee replacement? Usual patient who examined by me in office, and when I examine the patient and most of their pain and also some diagnostic studies such as X-ray was done in the office, and most of the disease located only at one compartment of the knee. And during my examination, most of the pain comes only from one part of the knee, and all of their ligaments is intact. So they can't have injury ACL or PCL, and they have a fixable deformity. So if they're bow legs and they're sitting in a chair and the deformity is correctable, they are candidate for a partial knee replacement.